Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
This is Richard Jacobs with the Finding Genius Podcast. I have David Corry. He's a professor of medicine, immunology, allergy, and rheumatology at Baylor College of Medicine down in Houston area. We're going to be talking about allergies and things like that. And, I probably sound like I have some, and I probably do. And I'm sure thousands and thousands and millions of people have them as well. So, David, thanks for coming.
Oh, pleasure. Thank you, Richard.
Yeah, what interests you, when you first got into this? Why were you attracted to studying allergies and rheumatology and immunology?
Sure. So my background is I'm a physician. My degree is MD, and I just naturally gravitated in terms of my clinical interests into lung disease. So the lung has a lot of interesting diseases that captured my imagination. And once I went through my training, I realized that in addition to just being intrinsically interesting, you quickly realize as a pulmonologist that you face a big problem when you start having your own patients, and that is people with very common illnesses like asthma, chronic sinusitis, an inflammatory condition of the upper airway, and many other related conditions that the best textbook and even advanced kind of treatments that you're taught as a pulmonary fellow don't always work. In fact, the more severe the disease is, the less likely the standard or even the advanced treatments are going to work. So my curiosity sort of evolved from just a general thing to wondering, well, wait, hang on, what's really going on with these people with these kinds of conditions, and what can we do to improve our ability to diagnose, treat, and that kind of thing.
So what kind of conditions are you focused on?
So in my clinic currently, we focus on advanced inflammatory airway disease. Mostly that ends up being severe life-threatening asthma, but we also see very severe advanced chronic sinusitis or chronic rhinosinusitis. But we also see folks that have smoked cigarettes most of their lives, so they have things like chronic obstructive pulmonary disease and or emphysema, but then become complicated by things that give them an allergic character. By allergic, what I mean is, they can show sensitization to pollens in the environment or to molds, and they have a particular character of the mucus that people frequently cough up with that have these kinds of conditions. They have a particular pattern of inflammation, including a specific type of inflammatory cell called the eosinophil. So they have this eosinophilic bronchitis is the term that we use for that. And so we collect patients with diverse kinds of lung disease, but that either have a pure form of this allergic character of inflammation, or they have traditionally non-allergic diseases like emphysema, but maybe interstitial lung disease as well. But then they develop this allergic character. So they all wind up in our clinic, and we diagnose and treat them using techniques that we've learned slowly about over the past 10 years on the research side. A lot of this work began in mice, and we have done the bench to bedside thing, adapting what we've learned in mice back to our patients. And it's been absolutely incredibly rewarding, not just for me, but I think for our patients to be able to, and it's been a great privilege for me to work with an incredibly talented group of folks putting this research together and getting to really what we think is the core problem that is underlying these different conditions.
Well, how do allergies form a backdrop to people's lives? And if they have these serious conditions, are they now more sensitive to allergies? Does it really worsen their condition? Like, what's the interplay there?
Sure. So allergies probably means is a kind of a broad term. It probably means different things to different people, but in general, so allergies means that you're making an inflammatory reaction to something that comes from the environment in a way that impacts your health. So allergies can take on many forms. The one we were just talking about, the one that a lot of people are suffering from in the south and the southwest Texas area, are again, the general term is allergies. But so you're making a specific type of allergic immune response to common pollens in the air. So in the winter, this could be, it could be cedar. Right now is grass pollens, and there's a number of different weeds that are blooming now, but there's also some tree pollens that are in the air. And there's always mold spores that are in the air. All of these are things that people can become sensitized to. So when you inhale them, you now develop a reaction that can vary in strength depending on your genetics and how much exposure you've actually had, and other medical conditions or drugs you may be taking that could influence exactly how strongly you react. But some of that reaction can be simply sneezing, itchy, watery eyes, runny nose, to nasal obstruction, inability to breathe through the night. If you have sleep apnea, then that actually becomes a health concern of significant magnitude. If your CPAP device, your positive pressure breathing device that helps you breathe at night, if you have the sleep apnea, it's not going to work so well if you have bad allergies and you can't get that air at night when you're asleep when you need it. And then things can progress very, very significantly beyond that. So if you develop a systemic allergy, if you will, to things like pollens and particularly bee venoms, if you get stung several times by hornets and honeybees, a common occupational hazard if you're a farmer in Texas and elsewhere, then that can be a life-threatening situation in which you might develop anaphylaxis with the next bee stings. Anaphylaxis refers to a systemic reaction in which your blood pressure drops and your airways close up so you can't breathe, and you typically pass out because you have no blood pressure. A perfect recipe for death, as you can imagine. Perhaps that is the most severe form of hypersensitivity reaction. That is allergic reactions that people can get into.
Quick question here. What are people's reactions like when they encounter mold versus tree or grass pollens versus other allergens, pets? Is there no specific signal depending on the type of thing that's bothering you, or are they specific in some ways?
So I think you're asking. So what's the kind of relationship between molds and some of these other things? So it's certainly possible that, again, based on your genetic makeup in particular, that simply inhaling things like cedar pollen or grass pollen, you can become allergic to these things. Most of the time that does not happen because our immune systems are smart enough to recognize that pollens are as you mentioned, dog and other animal danders, and maybe there's things that live in our households, including dust mites, cockroaches. Well, those things, die and disintegrate, and their dust is in everybody's house, and we are always inhaling those things. It is not pleasant to talk about these things, but they're not intrinsically dangerous either, and our immune systems typically understand that, and they don't go crazy and give us these terrible reactions. But the fungus is quite different. So that's the one thing that we can become allergic to that actually is a source of infection. So those fungus spores that are in everybody's house and they're always in the air. We're breathing in fungal spores with every breath. This is the one thing that can actually take up shop, if you will, in your airway, upper and lower, and grow, producing a condition we now call airway mycosis. It's not immediately a life-threatening situation. The fungus is simply growing along your airway, but that growth can lead to a number of interesting complications. You can become intrinsically, reactive to the fungus in the same way that you can become reactive to pollens. And so instead of, if you just have a cedar pollen allergy, you're only going to be symptomatic in the winter. So, you have a season for that, right? That's true for many different pollen-related allergies and allergic conditions. But if you're allergic to the mold that's growing in your airway, well, it's there all the time. And so you're always going to have a problem. And those problems could range from simple allergies to severe sinusitis to life-threatening asthma. Asthma, of course, a disease in which your airways constrict, and they can fill up with mucus and fibrin clots. A situation called plastic bronchitis, which can be fatal. In fact, the most common reason for death in asthma is because of this mucus and fibrin clot filling process, which basically you can't breathe at all.
Is that progressive with asthma? Like if you have asthma attack and it resolves, is that stuff still there in your lungs, or is there some remnants of its damage left there? And if you have an asthma attack again and again and again, what happens to you over time?
That's a great question. In the studies that have been done, in which the airways have been sampled in people that have asthma, looking for things like fibrin and mucus. So it's hard to say absolute certainty here, but it seems that if people have asthma, that they always have some degree of excess mucus and fibrin clot deposition in their airways, much more than, people that don't have asthma. So it's sort of a slow burn thing. It's always there. But yes, you can have these acute attacks that in which a lot more mucus and clot is being formed. And that's what's really the physical basis for the airway asthma attack that brings people to the emergency and gets them admitted to hospitals and that kind of thing. So there is that deposition deal, but there's also a constriction phenomenon. So with the airways of people that have asthma are hypercontractile. That is, in response to many different kinds of things, their airways can constrict. In addition to just inhaling the pollens, other things like just simply perfumes, hot air, cold air, dry air, many different things can trigger an episode of airway constriction, which can also produce that shortness of breath and bring folks into the emergency room.
How have scientists observed that people become conditioned, either in a good way or a bad way, or more sensitive or less sensitive to, various insults, continual exposure to pet dander, continual exposure to living in Austin, breathing in cedar every year, et cetera? What happens? Certainly continuous exposure to these kinds of things is definitely a risk factor for developing those allergies. But part of our research has uncovered is that there's an additional factor that drives those allergies in addition to just simply regular exposure. Again, things like dog danders and pollens are intrinsically harmless, right? They don't have there's nothing about them that is harmful per se, but we do develop these harmful reactions. And that has always been the paradox with allergic diseases. And again, some of the basis of my interest in these conditions. So what we've learned on the research side is that going back to that airway mycosis. So many people have airway mycosis. And it's having that fungus in the airway that drives the allergy. As it turns out. So we can demonstrate that in a formal sense in the laboratory for using mice as our test subjects, but we can also demonstrate that in people, so that if we take somebody that is highly allergic, again, I'm just using random examples, but cedar pollen, because we've used that before, but they also have airway mycosis, which we can demonstrate by culturing the mucus that people cough up, and then if we treat that fungal infection, that airway mycosis, with our usual antifungal medications, and are successful in getting rid of that airway mycosis, then the sensitization to the cedar pollen, even though the cedar pollen or whatever is not going away itself, we can see that the sensitization goes down and it may very well disappear completely. Okay. Well, so, have we figured out how to modulate it so that allergy sufferers who live in an area or an environment where they're going to have these persistent insults can fare better? Does it always have to be medicine to try to beat it down, the reaction, or is there a way to condition people positively so that it affects them less and less?
Sure. So a lot of this is still in the drawing boards, but let me try to walk you through some scenarios that we're working with. So first of all, in addition to the usual over-the-counter drugs, antihistamines, and nasal sprays, and nasal saltwater washing, that kind of thing, to treat these conditions. For more than 100 years, a standard therapy for allergists to use is immunotherapy, so allergy shots. So basically you're taking extracts of the things that you're allergic to, and then what the allergists are effectively doing is they're vaccinating you by injecting them underneath your skin on a weekly or monthly basis, depending on where you stand in the course of that kind of treatment, which can be quite long in duration, up to several years. But the idea, again, is that you're basically vaccinating against these things. And in many people, that is successful. It does diminish the just how badly you react to these things in the environment. And in some cases, you can completely eliminate those allergies, again, just by taking this vaccination approach. But for many people, and maybe this is something special for the Texas area, because there's just so many things to be allergic to. But the more things that you're allergic to, the less likely immunotherapy is going to work. So what do you do with somebody that has reacting to 20 different things? So maybe a better way of going about this, and again, here's where we're still on the drawing board, but is maybe first determining, do you have that complication of airway mycosis? And if so, maybe getting rid of that airway mycosis. So the treatment then is more of an antifungal approach, so taking antibiotics that kill fungi, to lower that sensitization to the point where you stop reacting. So we have seen that does seem to be true in the clinic in people that we are treating their fungal infections, not necessarily just because they have allergies, but because the fungus is something that's causing something much more serious, like life-threatening asthma. So, but they happen to also have those allergies. So we've noticed that in some of our patients that the allergies goes away at the same time the asthma. So that's got us thinking that maybe in the future that this is something that we can study in a formal sense. That is, giving the antifungals just treat the allergies as maybe an alternative way of treating, particularly those that are not responding to traditional therapies like immunotherapy.
So what clears up what? If you work on someone's asthma, do the allergies clear? If you work on their allergies, do the asthma clear? And how do you intervene depending on the circumstance of the person?
Sure. So immunotherapy can be effective in patients who have asthma. We don't typically do immunotherapy if you just have asthma. So immunotherapy is typically done if you have allergies, that is the itchy, watery eyes, runny nose, sneezing, postnasal drip, those kinds of symptoms, in addition to asthma. So if we can get that allergy component under control, typically, but not always, typically the asthma will get better at the same time. But primarily immunotherapy is given for the allergy component. When it comes to the antifungal thing, we routinely give antifungals, but we reserve that for more or less life-threatening or very serious infections, let's say, we've proven due to cultures or due to fungi involving the upper airway causing sinusitis or severe life-threatening asthma. And again, we've noticed that the allergies can improve in some people who we're treating for, let's say, asthma, but they also have allergies at the same time. Moving forward, it may be everyone's going to be a little bit different. Their circumstances dictate exactly the initial route that we choose, but increasingly we're thinking that maybe antifungals could be a frontline first choice therapy, particularly those with more serious medical conditions. There's some hesitancy there in applying antifungals widely without detailed study because there's several reasons. These antifungal drugs are typically expensive. A lot of insurance companies won't cover them if it's being used for an indication that's not been formally approved by the Food and Drug Administration. They're also can be quite toxic, and they interfere with other medications. So depending on what the antifungal you wish to use, that antifungal may not be compatible with the other medications patients are taking. So that becomes very tricky trying to change medications that you may not necessarily be qualified to change. So you have to work with other physicians to change those medications or get them stopped, that kind of thing. So it can be difficult starting antifungals and keeping patients safe while they're on them. So you don't want to just do this, willy-nilly.
Well, again, I guess we have a mycobiome, so an antifungal could disturb that, and maybe there's not nearly enough research into what happens with our microbiome. So is that why antifungals you shouldn't just take them for no reason or for too long, or what are the other reasons I'm not seeing?
So yeah, sure, we can talk about that. So there's a microbiome, right, which is typically people use that term to refer to the bacteria, right, that are in our bodies, and there's no question that bacteria are absolutely beneficial in many regards. So we rely on bacteria to provide a number of different nutrients, including vitamins, right? But the same, and there is a mycobiome, not micro, but myco, which is referring to the fungal component of the total body of microorganisms that are on our bodies. There's no question that we have a mycobiome, but there actually is no evidence that microbiome is actually beneficial. There's unlimited studies showing the harm that fungi can do wherever they may be. So they could be in our airway, of course. They're on our skin. They're in our gastrointestinal tract, and there's increasing evidence that they're in places you would never have expected them, like the brain. So fungi are likely in many, many, many different organs, including our pancreas, and other organs of our gastrointestinal tract, etc. But when they've been found, they've been often linked to various diseases, including cancers, inflammatory disorders of all kinds. Again, if they're in the airway, they're very likely to be linked to any allergic process involving that airway, including asthma, sinusitis, and even allergies, as we've already discussed. So there's abundant and there's unequivocal evidence of fungal harm being part of our microbiome, but there is literally no evidence that they have some sort of equivalent, absolutely essential good role that example that bacteria play. That those data just do not exist.
So what antifungals, from what I've heard, I mean, not having really taken them except for maybe like athlete's foot,
Sure.
They seem to work pretty well. Is again, what's the downside? Are there certain people that, because of their history with asthma or allergies, that they're very hair trigger reactive to them, or I mean, are there, does it matter the season in which you take them? What if there's a part of the season where you're very allergic to something and you're taking an antifungal? Does it affect you in one way versus another part of the season, let's say winter, where for the most part there's not much allergies, and does it work better then?
So not necessarily. So as long as as the physician has done their due diligence and really found that in fact airway mycosis is there and therefore is potentially linked to the underlying allergic disorder, you can it's appropriate, I think, to treat at any time of the year, regardless of the status of the sensitivity to the allergen that may be a secondary consequence of having that airway mycosis. So, but there are certainly downsides and side effects, as we talked about earlier, with antifungals. There's some very significant, potentially life-threatening side effects that are possible. So you have to monitor your patients very, very carefully. There's interference with other drugs, which can also be life-threatening. So that has to be monitored and planned for very, very carefully. There's some other interesting issues you can get into. Again, it's probably not related to season, but there's a curious phenomenon that's been linked to treatment of many different infectious diseases. The first such descriptions were in the 1910s and 20s. The first treatments that came along that were reasonably effective against syphilis, which is, of course, a bacterial infection. So the first time you treat syphilis, for example, with penicillin, especially, you can get a febrile, debilitating reaction with a lot of joint pains, and it can be life-threatening on its own. It was eventually linked to simply a whole bunch of the organism that causes the syphilis dying instantly in your body. Well, these things are going to release a whole bunch of things that your body is going to react to, and that's ultimately what is probably the cause of this syndrome, which has a long name. It's called the Jarisch-Herxheimer reaction, named after the original physicians who described it. But something similar is probably happening in a subset of our patients, maybe 10 to 20%. Who have a high fungal burden, a lot of airway mycosis, that is, and so we'll treat them with an antifungal. And within the first, I'd say 3 weeks, they can start showing evidence of something that looks an awful lot like a Jarisch-Herxheimer reaction. So they can develop joint pains, hives. Maybe if they have asthma, well, maybe their asthma will get a whole lot worse. It's a transient thing. They're over it in a week or so, and we can get through that by giving them anti-inflammatories like steroids and that kind of thing. But again, one of the other hazards of treating airway mycosis, so we can't just be doing this willy-nilly randomly. It has to be done in a carefully controlled way and under careful medical supervision.
So what are some of the big questions that you're trying to answer with your work?
So great, yeah. So and the question I always get in my talks, for example, is, all right, well, you just said that fungus is everywhere, and most people recognize that it's in every breath that we take, and yet only a small percentage of the population, all breathing in the same kind of fungus, develops these serious airway mycosis related disorders like asthma, chronic sinusitis, and there's quite a list of others that are not as common. So why is that? So that's one of the things we're pursuing now. Our hypothesis, our main theory as to what's going on is it's probably there's probably two different things, and it's, as with every medical condition, it's always a genes by environment sort of thing. So in some people, as you well know, Houston gets knocked off the map every now and then with a big hurricane or a big tropical storm. You don't have to worry about that so much in Austin, but these things come in and they tear up a lot of houses, pull off roofs, or simply flood the dwelling. And then depending on how well that remediation is done, if it's not done well, then the folks move back into what's effectively a mold trap. And so if the mold if it's not already growing, if it wasn't remediated well, it will soon begin to take over the house. And so now you're living in an extremely high mold environment. You're inhaling very high concentrations of molds, spores, but also potentially the toxins that molds leave behind when they grow in organic matter like wood and paper. And so you can develop.
Go ahead.
Yeah, you can develop very, very serious allergic disease simply on the basis of inhaling just too much. There's not a genetic issue here in many of these people. It's just overexposure. So the treatment there is just getting them out of their houses. And getting them into a clean dwelling. And that's actually a significant part of my job as a clinician is to exactly sleuth out that kind of environmental issue. And if that's the problem, then we work through the Veterans Administration to get, because I work at a Veterans Administration hospital here at Houston, and we get folks out of those dwellings and into better circumstances. But what's actually much more common is probably a genetic issue. So what we're working on currently on the research side is trying to understand there's probably some issues on the genetic side that predispose people to having more of a problem with this airway mycosis. So in particular, it ends up being probably an immune system related issue in which people are not able to fight off that fungus that we're all getting. So we're all getting infected by fungus through our airways. But most of us can fight it off and it doesn't end up creating a problem for the vast majority of us. It's just that 10% or so that can't quite eliminate the fungus that actually sets up shop and begins growing and expanding in these folks' airways. So those are the people that get into trouble with severe asthma, sinusitis, and we want to know in the future what are the genetic issues. So what are the specific genes that are affected, and what are getting down to the very nitty gritty? What are the actual changes in the DNA code, if you will, that lead to these kinds of problems? So we're actually working on that right now, and we hope to have some data in the next 2 years or so on that.
Yeah, in terms of living space, I don't know, are there simple tests to see if a place has been remediated or if you suspect that you're living in, poor ambient conditions, or is it expensive and complicated to do?
It's all the above. There are services that are available that can inspect your house and assess for mold contamination. That's typically expensive. Most people can't afford that, but there's another huge problem. There's a lot of companies that are not well trained in this kind of thing. So there are wonderful companies that do an absolutely great job, but they're probably drowned out by all the copycat companies that don't really know what they're doing. They'll do some work and tell you that maybe that you've got a lot of mold, and they'll charge you a lot of money. But in fact, the data that they come up with are probably worthless in many cases. So there's a problem. There's a huge problem with this kind of thing, and it's very hard to know as an individual what is the right company to contact to fully assess your house. So here's what I advise my patients. It's not worth going to that kind of expense and risk, not knowing who is really reliable out there, but learn to trust or maybe it's a spouse or somebody else in the family has a good sense of smell, to learn to trust your sense of smell. So if you leave your house and then come back a few hours later, open that door, what's the first thing you smell? Does it smell like clean air, or do you smell a mustiness, a moldiness that almost everyone recognizes as as a stale, damp, moldy, musty kind of smell that hard to describe exactly what that is, but most people recognize that odor. Our noses are actually incredibly sensitive in detecting moldy environments. If you detect that moldiness, you need to remediate. There is a problem, and you have to find it and you have to fix it. And so if that's where you are, and you don't really know where it's coming from, you just notice that the smell is there, then it may make sense to hire a professional, perhaps a highly reputable, highly recommended air conditioner company is a good place to start to inspect those vents and the ductwork and make sure that there's not mold growing in the air conditioning system itself. And that's a very, very common problem and a very, very common source for mold. The other thing, of course, are leaky pipes. If it wasn't an actual flooding event due to a hurricane, then leaky pipes connected to air conditioning units, particularly window units, or just old houses with leaky water pipes that are not easy to find. They might be hidden behind walls. So having companies come in with excellent reputations to help sort that thing out would be indicated. Again, if you notice that smell of moldiness or mustiness in the house.
Yeah, I've had a service come and do the air conditioning vents or the vents and, blow stuff through them. And it seems like the air is fresher and you notice a difference. And
yeah, super.
I've had what I think was like a rat that died in my closet and it smelled for months. And I didn't want to break open the wall and get to it. But, I'm sure everyone listening has had all kinds of weird things happen.
Absolutely. It's a very, very common issue. So in addition to critters, getting between the walls and passing away, right? And then the water, any kind of water leak for any kind of length of time, that will lead to mold overgrowth. And if it's in your house, then it just becomes an enormous, enormous problem. It doesn't matter if you have a genetic predisposition. That mold growing in there is just one of the worst things that to force a human to have to endure. But again, if you have a mold contaminated house, you have to live in that environment, and it's just it's a big health problem. Clearly, a huge message is that you have to be very aggressive in getting rid of that mold and keeping it out.
Yeah, I slept with a humidifier for a period of time, and it starts to affect your throat, and I've had to wash it out with vinegar and blow it through there and clean it, and biofilms form in there. And I open the window every day, and there's a lot to it. I mean, I'm sure building health and indoor air quality is huge in what you do. I don't know how much you deal with it, but
it's absolutely a huge issue. Just a quick tip for maybe your listeners, if you're thinking about how to manage your house to keep that mold out. So keep the humidity out, as you mentioned. Humidity can be a huge problem. You cannot, you should not exceed much above, maybe 45 at the most 50% in terms of humidity in your house. So if your air conditioner is not removing humidity to under 50%, you might have a problem. Certainly, if you're at 60% or higher, you've got a huge problem, and you need dehumidifiers in that case. Again, if your air conditioner alone is not sufficient to remove that humidity. Of course, in Austin and drier parts, maybe the issue is that there's not enough. Maybe you might be under 35%, which would be exceptionally dry, and that creates its own set of medical problems, right? So you might need.
That's what I was going to ask you. Is for someone living in a house, during the day and when they're awake, below 50% sounds good, but when they're asleep at night, it's probably okay to temporarily go above 50 so that your mucous membranes don't dry out. You don't have problems there, right? Like what would be the ideal cycle to you? Do you think that cycling is okay or not?
Don't recommend cycling because, again, if you're getting much above 50, certainly getting up to 60%, you're going to be, even if it's transient, a few hours a day, you're going to be promoting that mold growth. It's just you don't ever want to get much above 50%. So most people for 50% can sleep very comfortably in that range, but perhaps some people maybe that is too dry for some people. I personally have not run into that. So maybe you're the first. But I wouldn't recommend generally cranking up the whole house humidity much above 50% for any length of time.
Pretty narrow window, and then in the winter the water just can't hold nearly as much humidity. So I mean, what do you recommend? Do you think people should get like hygrometers in their house and try to dial in the humidity to a certain level? And if so, it seems like a very narrow range.
Absolutely. I recommend everybody get a hygrometer. Everybody should know what their humidity is in their house, and you might need to move that hygrometer to different rooms because it could vary from room to room. And so you should know pretty much your whole house. How does that humidity fare, and particularly in different times of year? And so again, if you're finding it's getting upwards of 60% for sure, but I would be concerned even if you're in the upper 50s, that you might have a problem over time with that mold overgrowth, and which would be it could be a very serious health problem. Depending on the individual, and so yes, you may have to take action then to maintain that humidity at the right level under let's say 55%, let's say, in different times of year.
Okay, but there's no protocols of, even brief cycling, like I don't know, stuffed up. You take a hot shower with steam, and it seems to help for 15 minutes. Or are there any protocols of where you go really dry, where you go really humid for a short period of time? Or you don't recommend it?
No, I don't recommend it. That kind of extreme cycling over short periods can lead to is very hard for the body to adjust to. So let's just take up the example we were with earlier. So let's just say that at a certain time of year you find that a relative humidity of 50% is maybe a little bit too dry. But if you were to maintain that level of humidity, your body will adjust, and you should be acclimate to that and become comfortable with it. So I actually recommend that you know what your humidity is at different times of the year, in different parts of the house, and then you do everything that you can to keep it to keep it at a constant level. And so again, you want to shoot for under 50. 5% or so, perhaps ideally even under 50%, but that's hard to achieve, particularly in Houston where it's so humid. I'm guessing that'd be much easier to do in Austin, but generally under 55%, and try to maintain that however you need to. Sometimes that may mean turning on the dehumidifier. But in other times of year, maybe that means turning on the humidifier, right? So consistency and as constant a humidity as you can is the best way probably to deal with this long term.
Yeah, I was just thinking if you do, I'm not saying to do it, and it sounds like it's bad, but if you do this cycling, what you might be doing is encouraging mold formation or fungal formation. Then if you suddenly shock it with low humidity, maybe it goes into spore form, stays there, and waits for humidity to come back. I mean, who knows? But just a thought that crossed my mind.
So you sound like you've had some mycology training. So that's exactly right. So when you stress, you get the fungus growing and then you stress it, and desiccation or drying out. It's certainly one way of doing that. They will sporulate, and so you may be encouraging spore formation and subsequent, mold, enhancing the moldy conditions. So again, cycling is something for many reasons. Cycling is probably not the best in anyone's best interest.
Okay. Well, very good. Well, what's the best way, Dave, for people to find out more about your work? And if they're local to you, I guess in the Houston metro, maybe they can come visit, or, again, how should people find out more?
Sure. So I'm on the webpage at Baylor College of Medicine, and my contact information is there. If you're a veteran and you think you have an allergic disorder or an airway disorder, immunological disorder of any kind, so our clinic would be delighted to see you. We are restricted to just the veterans population. However, working with my other colleagues at Baylor College of Medicine, we have an outstanding allergy and immunology clinic available through the Baylor St. Luke's Medical Center. I do not work there in that clinic, but I'm certainly affiliated with it, and I work closely with my colleagues with complex allergic and immunological conditions, Dr. Sanjeev Sur and Evan Lee, and we would be happy to see you at any of these venues. should you have a condition. If you have a research condition, just drop me an email or whatever. We'd be happy to take the conversations further.
Well, very good, David. Thank you for coming on the podcast. I appreciate it.
Hey, Richard, it's been a pleasure. Thank you so much.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.